Hi, I'm Lauren.
I'm Jeanette.
I'm Abby.
I'm London.
And I'm Amy. For our Healthy People 2020 assignment, we were assigned blood safety.
Blood safety and products being such a high-risk procedure and placing patients at risk, they are moving toward a national policy and procedures so that mistakes don't happen and everyone follows the same outlines for blood products. Our objectives are in the developmental stage, which means Healthy People 2020 knows these issues and disparities exist.
According to Healthy People 2020, their goal is to prevent illness and disability related to blood products and disorders with the use of blood products. So with them, their policy is to ensure adequate, timely, and easily accessible supply of safe and quality blood and blood products through the establishment of National Blood Transfusion Service (NBTS), develop effective legislation and national regulatory body to oversee, governed by national blood policy legislative frameworks to promote uniform implementation of standards and consistency in the quality and safe blood and blood products. How they do that, according to WHO, is their procedures are all blood product components are logged and recorded electronically when possible. Some don't have the option to do it electronically. Provide vein-to-vein traceability, ensuring that each blood component is handled and stored correctly, given to the right patient for the right reasons, and that records are retrievable in compliance with Blood Safety and Quality Regulations 2005. All patients, when receiving any kind of blood transfusion, have to complete a consent for blood. Accurate identification of patients at all stages of blood transfusion process is essential. All patients receiving any blood product must have a type and screen done and must be identified with OUH wristbands, which is compliant with the Trust Patient Identification Policy. Positive patient identification must be used to ensure that the wristband is on the correct patient and is attached to the patient prior to blood sampling or blood administration.
According to Healthy People 2020, there is a slight disparity in race, location, and disability regarding blood donation. Accessibility affects a patient's overall health, leading to complications, including those related to blood diseases. This can also affect the availability of blood and donors. Three components of healthcare include coverage, service, and timeliness. Barriers to health include cost, insurance coverage, and availability. These can lead to unmet health needs and delays in care. Of blood donors who are white, non-Hispanic members of society versus a 2.1% of blood Asian. 2009 showed an increase in Asian blood donors, but no statistical difference in white non-Hispanic donors. 2010 shows a statistical difference with 2.9% of donors being African American, non-Hispanic, Latino members of society. Health interview survey, 6.6% report living in a non-metropolitan area in 2008 versus the 6.1% in a metro area. Notedly, 2010 shows a steady decrease in non-metropolitan areas of 0.2% yearly, while the metro area fluctuates. Interview survey reported that 3% of those who donated blood had disabilities, while 6.5% did not. The delay in time between identifying a need and actually fulfilling that need can negatively impact health. Patient Protection and Affordable Care Act of 2010 expanded healthcare coverage, however, millions still fall through the cracks. Expanding legislation and outreach programs to improve access for at-risk populations.
The first objective was to reduce the proportion of adverse events related to blood incompatibility. And on a national level, we have to improve the accuracy of patient identification. We have to eliminate transfusion errors related to patient misidentification. And in order to do this, we use a two-people identification process. When using the two-person identification process, both individuals, their license has to state that they are qualified to hang the blood or at least witness it. It differs per hospital policy. So currently 20% of hospitals have these reactions taking place, and a disparity in this area is that the OR and the ER are the only ones that are able to override these policies and can free hang blood during emergency situations. Complications can be related due to human error or delayed hemolytic transfusion reactions, and that is typically caused by weak antibodies that couldn't be detected at the time of cross-match. When this occurs, make sure that you stop the transfusion and you send the blood product back to the laboratory for testing, and you have to monitor the patient's vital signs. It happens every 1 in 70,000 units. So, an acute hemolytic reaction is the rapid destruction of red blood cells that occurs during, before, and after usually about 24 hours of a transfusion when a patient is given an incompatible blood type. You also have a delayed hemolytic transfusion reaction, which is when the recipient develops antibodies to the red blood cell antigen between 24 hours and 28 days after the transfusion. Important facts that you need to know: you have 6 minutes or less from when the patient has received the blood for you to be able to send that blood component back to lab in case they have developed a reaction. You have within 30 minutes of picking up the blood product to hang the blood. Blood has to be hung between 3 to 4 hours. So some symptoms that you could look for. So our next objective is to reduce the proportion of persons who develop adverse events due to transfusion transmitted infections. Blood screening programs that can protect the recipients of blood transfusion from transfusion transmitted infections. Our target is to protect a secure blood product supply from known and emergent blood-borne pathogens. In order to do this, we are testing on blood samples to control the blood. Each donor is screened for transmissible disease by questionnaires, and each unit of blood donated in the United States is routinely screened for various infectious diseases. Before an individual donates blood, they are asked a set of standard questions to assist in determining if they are in good health and free of any diseases that could possibly cause a reaction later on. So if a donor's answers indicate that they are not well and they are not healthy or are at risk of having infections transmitted by the blood, labs need to be within normal limits. If they are not, you are not allowed to donate. All blood is tested for bacterial contamination, Hep B, Hep C, HIV, human T lymphotropic virus types 1 and 2, syphilis, West Nile virus. Trypanosoma cruzi and cytomegalovirus are not tested. So a good to note fact: if a patient is needing blood for any reason, they can receive blood as both autologous and direct from individuals with similar illnesses as them.
Our third objective is to reduce the persons who develop adverse events due to alloimmunizations of hemoglobinopathies. The national goal is to reduce proportions of persons who do develop adverse events due to the hemoglobinopathies. The target of this is to increase testing and awareness for carriers and their families. A baseline of hemoglobinopathies includes sickle cell and thalassemia. The treatment for these conditions is multiple blood transfusions. However, this causes alloimmunization. For these genetic recessive disorders, they require blood transfusion as a source of treatment. A fourth objective is to reduce the persons who do not receive red blood cells due to a blood product shortage. For a national goal, we try to keep blood supply adequate, safe, and effective. The target is to reduce a proportion of people who do not receive red blood cells due to the shortage. As a baseline, 6.1% of people 18 and older donate blood. We need to increase this percentage. For example, blood banks have shortages during the summer months because schools don't have blood drives, and so the ages 16 to 18 are 10% of the blood donors. Approximately 36,000 red blood cell units are needed on a daily basis. And so that means that we would need 13,140,000 units per year. According to the National Blood Collection Survey in 2011, 1,978,000 units were collected. Our last objective is to reduce proportions of persons who do not receive platelets due to a blood product shortage. Nationally, every 30 seconds, someone in the United States needs platelets. Our target is to decrease the percent of people who do not get platelets because of the blood shortage. And as a baseline, platelets need to be used within 5 days, and nearly 7,000 units are needed daily, which means 2,555,000 units are needed per year. There is not much information on this because the fourth and the fifth objective go hand in hand with blood shortage in the United States.
So during this blood process, there's many ways that we can go wrong. So therefore, there's so many stops and checks along the way so that we don't go wrong. For example, the blood bank types and crosses all blood. The hospital will label it, the phlebotomist will make sure it matches the patient's unit and the patient's blood type. There will always be 2 nurses doing these double checks, and then to watch out for signs and symptoms of reactions, stay with the patient for the first 15 minutes. All this is in place to ensure a safe blood process. Now, I'm sure many of y'all watching this have donated blood already. There are 3 different types of blood donations. There's volunteer, paid, and direct. The requirements to donate blood: you must be in good health and feeling well, as discussed previously, and you must be at least 17 or 16 with parental consent. Down below is a chart that explains the height and weight difference. Typically it's 110, but that is height dependent. As mentioned before, we ask that only people that are feeling well donate blood. Listed below on this slide, it goes through different things that we ask. If you have done this or if you have this, please do not donate blood, just so that we can keep our blood supply safe and uncontaminated. For instance, in New Hampshire in 2012-2013, there was an outbreak of hepatitis C. Because of this, nurses and phlebotomists had to go out into the community to test people who may have received this blood. So across the nation, we have these safety features and these standardized protocols so that we don't see this again. So across the nation, we are facing a blood shortage. Both blood collection and utilization is declining, but that gap between the two is narrowing. As collections decline further and further, we have less to give for transfusions. So some states are facing the worst shortages ever. Big shortages occur in the Northeast, and this is due to increased complex therapies such as chemo, organ transplants, and heart surgeries, which require an increase in blood products. If we don't have blood available, we don't have it for these procedures. So, also a good point to know is that for some of these bloods that we are facing a shortage in, the blood type is super rare. So we're trying to get more and more people, such as people with AB negative, such as people with AB blood, to come out and donate. In Louisiana, there is a massive blood shortage within the state, where some blood banks are faced with only having a day and a half supply on their shelves. This was major when Hurricane Harvey hit. One of our blood banks did not have enough to give the victims.